moment. Welcome to the Amazing Cities and Towns podcast. I'm Jim Hunt, your host, and today's episode will focus on a very important issue affecting local governments throughout the country. Our guests are Mr. Angelo Consoli, president of the Fraternal Order of Police in Prince George's County, Maryland, Lodge 89, and Colleen Hilton, a licensed therapist and founder and CEO of Alli Connect, a Seattle-based technology company that assists in finding the right therapist for mental health care. So welcome, Angelo and Colleen.
Thank you.
Thank you.
Let's go first to Angelo. And Angelo, kind of the lived experience that most police officers have is certainly interesting. And I'd like for you to give us a little introduction, just put a face on your career as it kind of concludes now, or as at this stage of the game. You're the president of the FOP in Prince George's County. But tell us a little bit about your experiences and your career.
Right. I have I'm actually just hit right around 35 years of experience. Started in college, had a desire to look into policing. So I actually worked for the police department as a student, doing security work through college. And once I graduated, I started my career with Prince George's County. Just celebrated my 30th anniversary with Prince George's County, November 1st. Spent about 18 of those years on the streets, patrolling in various functions, all the way up through shift commander, which is lieutenant. So I was a sergeant and a lieutenant on the road. And I, outside of being on the road, only spent about 13 months in internal affairs, where I also got another appreciation of different side of policing. And then in 2011, I came down full release for the FOP, first as second vice president, then first vice president. And then in 2020, I took over as president of our organization. And later that year became the second vice president for the Maryland State Lodge of the FOP, which I've been doing both of those since then.
And Angelo, when we talk about mental health and tragically in many cases, or a lot of cases, suicide among first responders in general, give us a little bit of your kind of experiences and just your thoughts about that. I know that, I'm a father of a police officer, and I recognize myself that I know so little about what, the experiences, how they happen and what happens, because quite honestly, my son doesn't share a lot with me in that, because I think of the serious nature of it. So tell us a little bit about, from a police officer's perspective.
It's throughout my career, it's even changed. When I first came on the department, it wasn't something that people talked about too often. It was something that I guess most guys that were contemplating it or weren't feeling good, kind of felt they had to deal with things themselves. And I think a lot of it boiled down to what kind of ability you had to deal with the issues, whether you had outlets or family that you could talk to. It was something shied upon. Most people were afraid to seek help. But through the years, I've had many colleagues that I knew that have committed suicide for varying reasons. Some probably related to the job, some would never know why, and then others due to medical reasons, that they just decided suicide was a better way than dealing with the medical issue they were going through. But over time, I've seen through officers that we've dealt with, and as it's increased, that a lot more people are willing to talk about it, and the stigma is finally, in the last few years has started going away. People are more willing to talk about it. The only issue now is the officers want to make sure it doesn't affect their job, doesn't affect and that there is confidentiality in the system, and that they're going to get the help when they ask the help, because it's a big step to ask for it. And if they're not going to get the help and it's only going to hurt them in the job, then, that keeps people secret, to stay secretive. So I think that's the big thing. And that's the strive for what we're trying to get to now, is finding good systems that are in place that officers have very easy access to, but also trust in it and feel that they have the confidentiality that they need.
And those, when you put that face on it, and I think a lot of times people don't recognize that it's not that easy when it's your job at stake, your career. It's kind of the peer pressure among others that, and we kind of know when we view a police officer, we view them as a kind of this strong, silent type, I guess you'd say, that sees a lot but never is affected by it. And we just know that that's just not the case. And, I think as you describe it, that very few of us in my career, I've never felt that reaching out for help would affect my job. And, that somebody finding just that out, that I'm wanting to deal with something, that would be viewed in a negative way. And that's something I think that, like you point out, it happens.
Right. And I think the other thing to look within it is, for a lot of officers, part of the job and everything is people do look at you as being able to handle things and take a lot of weight on your shoulder. And people don't realize that, at the end of the day, we are human, and we see some of the worst things you could ever see or imagine in life. But we also have, just within the day, the monotony of the job that's kind of boring and long, but you can, the snap of a finger, all of a sudden be at the highest stress level you'll ever be for the day. And for some officers, I think the stigma that came with it is I can't admit that I'm broken, or that there's an issue, or there's a problem. But I think people are realizing now that, what, you're not doing anything any different than the rest of the world's going through, and that you are allowed to have, feelings. But the important thing is to take care of them, because, with the right help and with a right support system, you can make it through, and you can still be a productive member of any police agency.
Great. And Colleen, why don't you, listening to Angelo and I know you've got an extensive experience in dealing with that, both as a licensed therapist and now with Alli Connect as the founder and CEO. Tell us a little bit about your background and kind of bring us up to date, and then a little bit about Alli Connect.
Yeah, thanks so much. And Angela, I just want to validate everything you said. I'm sitting here nodding because so much has changed, and yet we have so much further to come as an industry and in being proactive around mental health. My background and what actually brought me to doing mental health for first responders was part of my family history. I come from a long family of military service in many different branches, and then actually married an individual who became an LAPD cop. Later, we moved the family to Seattle PD. So over a decade of my life being a spouse, and then training up in this field. Really, when I joined, the differences were so amazing in the sense that, as a spouse, we didn't even talk about mental health. We were sent to wife class and told how all of our marriages would end, and basically how our spouse going into the recruit class was, the beginning of the end, so to speak. So it was really, really dark and negative. Whereas now I see so many agencies, including family members, in the recruitment process and the training process, and it's very proactive and supportive. And how do we help individuals thrive and stay resilient throughout their careers, which is tremendous. But Angelo, to just kind of double tap on what you said, there's still a large segment of officers and their families who don't voice the need for help until either there's a massive crisis because they have no other options, or they don't do it leading up because they're afraid that it will have some negative impact on some aspect of their life. So it's really important to be having these conversations to shift that narrative, because there's so many people like you, Angelo, who are really leading the charge around it's okay to ask for help, and we can get you to the right provider so that you can actually get the right help to maintain your health and wellness and stay an active member of the career.
And Colleen, so, one of the things, and like you said, the kind of that experience on the entire family, and you've pointed out, and I think that is a good point to bring up. It is just an unusual profession that certainly includes the spouse and the children and other family members, but a lot of times just are not. It is a dismal outlook sometimes, that you're thinking, I'm entering into a marriage with this person who's really going to be undergoing these different stresses that are, serious. So when tell us a little bit about, like, kind of how with Alli Connect, what was the kind of that founding passion on your part to look into this?
Yeah, absolutely. So long before Alli Connect, I really had a passion for what we call culturally competent care for this profession. Police, fire, military, all of these individuals who serve our communities and have these additional stressors. One of the most important factors as a clinician, I know, is finding that right match, finding somebody who can not only serve the clinical needs that you have, the anxiety, the depression, the PTSD, but somebody that you, for lack of a better term, click with, somebody who you feel like they get you. And so you can build a trusting relationship. Clinically, we call it the therapeutic alliance and finding the right clinical fit. But seeing the difference that finding that right therapist has for individuals and by extension, their entire family, the department, their communities, I became really passionate around kind of ending what we have now around this kind of trial and error, throwing a dart down a dark hallway, hoping you land on a therapist who has availability, but rather helping people find the right therapist in the right moment, preferably proactively at the very first day of their career, so that they can maintain their resiliency. Because that's the other bias that I guess I have around first responders is we talk a lot about resiliency training, but I believe first responders are inherently so much more resilient than the average individual. You don't get into this career if you can't already handle quite a bit, which goes to Angela. One of your first comments was, when they raise a hand, we've got to be right there with the right support, or we're going to miss that moment. And that's where individuals can go months, even years, without getting the care that they need. So in founding Alli Connect, I'm really driven to help people find the right therapist the first time in the moment that they need them, and using technology to really expedite that process, so that we're reducing the amount of trial and error and ultimately human suffering.
And Angelo, I know you've had those experiences where the stressor, the kind of seeing something that people shouldn't see, but you're right on the front lines. And Colleen mentioned in terms of timing, having an appointment 3 months later, can you kind of give some insight into that whether that is not an effective way of treating mental issues?
Right. It's not. And for a lot of officers, you need it immediately. And that's why, the one thing I'm glad about our agency is that they recognize that when it comes to some critical incidents that you need to get it, whether you want it or not. The ability to talk to someone that has the ability to listen and guide you in the right place if needed, or just to listen to you to where you get it off your chest, get to deal with it. I think for a lot of people, it's just that, just being able to say it, talk about it and deal with it is what does it. I credit like me being able to survive as long as I did, and we talked about before, I'm married to a police officer as well, so we've made it to 27 years, and a lot of that comes from the fact that we are each other's sounding boards, but we've had other outlets that we have as well. So we've done very well, being able to handle the stress, but also the other thing is making it through that as long as we did as police officers in a marriage. But the ability to get the help when you need it has to be the paramount. You can't wait, and especially because a lot of officers, what we're used to doing is putting it down, ignoring it, and letting it go. And if you get to a couple of days later and you've done that, you move on, you move to the next one, and eventually those things build up until, like any shaken soda can, you're going to explode.
And Colleen, I know across the country, and you operate throughout the country, many states are looking at this as a way of providing care for both suicide prevention and mental health wellness, I guess you'd say. So what's that look like across the country on these various states that have put this in as a mandate?
Yeah, that's a really important topic. I think, Angelo, to what you were just saying, more and more legislative bodies and governing bodies are recognizing that officers often struggle and suffer from death by 1,000 cuts, that it's not necessarily a single incident that leads to potentially PTSD and suicidal thoughts, but that the accumulation of stress and incidents, at some point, we all break. It's just too much to bear. So we've seen a lot more legislation coming into bear, and many states both recognizing the long-term impacts and that death by 1,000 cuts, PTSD, being attributed to service as a whole, as opposed to a single incident. But we're also starting to see mandates around proactive mental health check-ins, everything from annually to even quarterly, where agencies are now being encouraged, if not required, to really touch base with those officers, on a regular cadence to make sure that there isn't anything kind of boiling underneath the surface that's going undetected. I think that's a really important component in this cultural shift and reducing the stigma, is that if we can normalize the mental health check-ins in the same way that physical wellness check-ins have been normalized, and normalize proactive tools like Alli Connect in the same way we use ballistic vests to protect against a physical injury, we're going to be protecting the entire person, and they're going to be better off as a whole in turn.
And one of the, and I know, spending a lot of time on the policy side of local government, and sometimes when things are mandated, they end up kind of the check the box, so that it's not true services, but it is checking the box. And I think a lot of the Colleen, maybe just talk about the difference between checking the box and actually having a true, just like Angelo said, is needed, is immediate access to care and the right care.
Yeah. Well, I think agencies really need to start looking at what is their culture right now and what are the solutions that are going to help create supports for their individual officers based on that individual culture. So I don't think there's a one size fits all solution. In terms of checking the box, I think we've done that historically as a society, not just in the first responder industry, but in government and city municipalities, by leaning into EAPs, which are employee assistance programs. Which oftentimes provide 3 to 6 sessions for a client who might reach out to their human resources contact and say that they're needing help. The challenge with these programs is that they were never designed to support first responders. They were really designed to support, minor stressors that might be brought up by, I'm going to say, an administrative employee, which is very different than somebody who's first responding in the field. The other thing is what, Angelo, you said about trust, right? And it's very difficult for an officer to call human resources, pick up the phone and say, hey, by the way, I think I'm struggling with alcohol abuse. I need help. It's, tantamount to career suicide. They're just not going to do it. And we see that in the statistics that first responders have less than 2% utilization with employee assistance programs. So I'm really encouraging agencies to put together their own programs, partner with companies like Alli Connect and others that are in the industry that can build something that's more customized, and provide access to care to what we call culturally competent therapists, or therapists who actually know and have experience in working with these specialized professionals.
And Angelo, I saw you shaking your head. Can you give us a comment on that?
Well, the thing I've seen over the course of my career is just that our county's had EAP for a very, very long time, and officers have been very shy about even getting involved in it, because it's just that you're calling your OHRM to say I have an issue, and there's a fear that it's not going to be confidential. There's a fear that it could affect your job. And also I don't think people have a lot of trust in it, getting the job done. And that's why, what we're trying to do, in Maryland anyways, is do a push for more ability to give us the preventative stuff. There's a lot in place for, diabetes, heart issues, things like that. But, when it comes to mental health for police officers, I think finally the country is starting to see that, we got to deal with that. That is an issue within policing that's just as prevalent, if not more, than some of these other medical conditions for the regular citizen out there. And actually, when it comes to policing, I was looking at a statistic the other day. Suicide actually beats out line of duty deaths per year. And so that's something that we have to take serious. And our big thing is that we need to ensure that all officers have the ability. And then our other fear in Maryland is that the bigger counties like mine have the ability to put in better resources, where it's the smaller agencies that we're concerned with at the state level, because a lot of them don't have the resources, and that's all you're going to get is the check the box EAP. And some of them, it's not even within your own jurisdiction. It's like, use this other agencies or another jurisdictions, so you don't even know what you're getting, and it's not even someone that's familiar with who you are and where you are. So those are the big obstacles that we have to overcome, I believe.
Yeah, and
Angelo, I would have to agree with what you said about the smaller agencies. It seems like unless you're huge and you have a ton of financial backing and it's a lot of visibility, smaller agencies are really, stuck between a rock and a hard place, trying to figure out what to do. Those are the agencies that I think in the short term get the most benefit from scalable solutions outside third parties like ourselves, who can come in and kind of cost efficiently drive something better. But, I look to large organizations like you and frankly, like the state of Maryland to help lead the charge in this proactive approach to mental health. Because exactly what you're saying, we screen for diabetes and cancer and cardiac incidents because we see the value in the officer staying physically well. But I would argue that if an officer isn't mentally and psychologically well, it's a far greater danger to himself and to the community than the physical injuries.
And I think one thing too, we focus in on the kind of the line officer, the people that are out there on the front lines. And maybe Angelo, you could speak to it. There's a whole cadre of staff that interact, and I know 911 operators, EMS, fire personnel, first responders in general, and people that support first responders, that when those incidents happen, that psychological pressure and stress is on that. Angelo, could you speak to that a little bit too?
That's correct. And, people, forget within policing, it's not just the uniform police officer you see that goes to the call for service. I mean, those are your frontline guys that do tend to see the most. But on the backside, you have, even within the sworn ranks, you have the investigators that investigate some of the crimes. Then you also have civilians that work for us that do the evidence collection, counseling, other areas, and some of the traumas that they have to deal with and see with people. We have the child and vulnerable abuse unit, the sex assault unit, homicide unit. They go through a lot and see a lot as well. And then you have, like I said, the civilians that support all them. They go through just as much, and that's why it's got to be rounded for the whole profession, not just the line officer that's getting in and out of the car.
Colleen, and what's your thoughts on that and the kind of the implementation of that?
Yeah, I'll agree 100% and take one more step to families and retirees, just because this is a family career for so many people. And when we go through the retirement process as a first responder, those first 6 months following kind of separation from the agency are incredibly difficult. Somebody spends an entire 20 to 30 year career serving the community and suddenly they're not an officer anymore. So it's not uncommon for there to be a pretty incredible identity crisis that can lead to depression, anxiety, suicidal thoughts. And we're actually seeing that kind of 6-month period post-retirement is becoming one of the riskiest periods of time for first responders. So when I think about implementing a solution, I want to touch all the enlarging circles of communities that are around that officer themselves. And putting technology in people's hands and educating them around this proactive approach and really mental wellness as opposed to mental health, I think is going to be a cornerstone in our success as an industry moving this forward.
And Colleen, mention or talk a little bit about, I know technology, and we're using technology today on recording the podcast. And so, and one of the challenges, I think, that in terms of police officers and other support staff even, but seeking help, the traditional office where somebody drives up, they park in the parking lot, they go inside, sit in a waiting room. And in police work, and I know, my son has educated me on this very clearly, is that, you go to a restaurant, you see someone that's under investigation for active drug trafficking. You go to a counselor and you see someone there. And then once somebody recognizes Officer Smith as being in those public places. So technology, I think, has the ability of helping with this, but expand on that maybe a little bit.
Yeah, absolutely. So we found even prior to COVID, but it was really researched and validated during COVID, that therapeutic modalities over this type of Zoom environment are just as effective as sitting in a room with that person. I'm going to say the other side of that is what you mentioned, right? There are some risks for first responders to be seen going in and out of a therapy office. And, as we fight to improve the stigma, there's just the simple embarrassment risk of, I don't want to go into a waiting room and see another guy from the crew. I'd like to have my privacy around that. But the other side of this, and I'll kind of like harp on this because this is the passion point for me, is that clinical fit, right? If I'm focused on sitting in the room with a therapist, that might limit my options because so many therapists are now working over telehealth, at least part-time, if not full-time. And the most important factor in somebody getting the help they need is really the relationship that they can build with the therapist. So I encourage everyone to be open-minded around using telehealth services, because you may be able to find that perfect therapist who's maybe just outside the geography that you would have otherwise looked and still local, and be able to meet with them in a much more private and convenient way, giving kind of a better holistic experience to mental health treatment.
Angelo, and I said it, you know, every time you look and somebody has a little bit of gray hair like you and I do, is that you recognize that I think technology has evolved to the point to where it's almost like, you know, the cell phone now and other things. But what's your thoughts on the people
Right.
you know would be helped by that?
No, and I believe that's too. I mean, we see it in our daily thing just with the union here. You know, we have an app for our members, and you know, like I know our national vice president, the big thing he always says, if you can't get it on your phone, then you know you're missing it. You know, because that's where all especially the newer officers, I'd say in the last 10 years, everything's on the phone. So you know, the technology is a big thing for them. So I think that they want to be able to do the quick fix. And sometimes, you know, it's just like we had said, you need the ability to talk to somebody. And I don't necessarily have to do it in person. So if I can do it, you know, that way as well, and especially with everyone running all over the place nowadays, and I think an important thing that Colleen mentioned is, and I did forget it earlier, is the family side of it. That, you know, we are looking into making sure that the families are covered in a lot of these mental health things. It's not just the officer, because you know some of these things spill over into the family life. And so if you got issues at home or stressors at home that are caused from this job, then you need to make sure that the family also is getting the help that they need, because those stresses at home also increase the stress on the officer as well, but also the family. So, and the goal at the end of the day is to make sure that everyone gets the help they need, but also hopefully it helps keep the family together and keep them strengthened, because at the end of the day, that in and of itself becomes a big stressor down the line, if you're now splitting the families going in 5,000 directions as well. And sometimes the technology does help us with that, because you got, you know, the kids are on one side of town, the wife's on the other, you know, so it's a lot easier to make an appointment and everyone grab the phone and pull off to the side of the road for a half hour. So I think it's important that, you know, we definitely do advance with the technology.
And Angelo, I know, you know, one thing that, you know, when I started my elected career in local government, the police department, in essence, they had a car. They had and back, I'm not that old, but it was almost like a billy club, and the taser at that time, and their weapon, of course. But even bulletproof vests were not the standard issue at that point. And now you fast forward, and we have the other added stress, I think, for police officers, is that they go around with a camera mounted to their chest. And every encounter, and we've seen it online and on social media, where all of these encounters are recorded by both the officer and then 3 people or 10 people with cell phones out. And that stress, I think, of that, you know, we look at it as accountability, but it also is very few people that put that in effect. Like, you know, when I was on, you know, mayor or city council, I would never have agreed to wear a camera 24 hours a day in my meetings and stuff. And yet we're expecting police officers and others to do that. So has that added into the, for these younger officers coming up, and even some of the older, that as a fact?
I mean, to some extent. I mean, the big thing about a lot of the cameras is that the officers actually, you know, most of them have welcomed them, because one of the biggest stressors actually that most of us went through, and I definitely through my career, it was the complaint that you had against you, that took, you know, almost a year to come to resolution, puts a bigger stress on you than anything you've seen, because you live in that for a year, and especially if it's a serious enough allegation where, you know, now you're worried about, you know, am I going to have a job, or demotion, or even a hefty fine for some guys, you know, because now it's finances that you have an issue with, and a lot of people overlook that finances actually are a big stressor for a lot of people too. That you know, that those are the issues that people are, you know, our guys are dealing with, and you know, it's forgot where I was going with that, but
Yeah, Colleen.
I'll have to agree with you both. I mean, we do a lot of data analytics with our partners because we believe there's a strong value in helping people identify these undercurrents, and things that you gentlemen just identified are the leading indicators that we see of mental health crisis for individuals and for organizations. That kind of organizational stress, personal, financial stressors, and relationship distress. I think we often talk about substance use, we talk about PTSD, and those things are very real, and I don't want to discount them, but they often become symptoms of these deeper issues that somebody has been battling for years. So acknowledging them and understanding how it's different today than it was even when I started as a spouse in law enforcement, to help people get ahead of these stressors and really stay well is really important.
Well, our clock has ticked along, and this has been a fascinating discussion. And I truly appreciate, Angelo, your insight of putting the face on it, because a lot of times, when people are out trying to find solutions and they don't actually ask the people who deal with this on a daily basis. And in your case, Angelo, and I didn't know that offhand, that you were married to a police officer also, which is a unique aspect of that. So I just want to thank you for taking the time today, and Colleen for kind of having at least a possible solution. And I think what we've heard today, and seems like there's agreement on, is that you're on to something that gives a very effective way of providing something that the alternatives in many cases line up, that they're not as good alternatives as we could hope for. So I want to thank you. And Angelo, good luck with all of your members in Prince George's County, and Colleen with Alli Connect. And we'll have contact information on the podcast notes. So if anybody wants to get in contact or talk to Colleen or Angelo, they'll be able to do it.
Great.
Thank you.
Great. This has been fun. Thanks very much. This is Jim Hunt for the Amazing Cities and Towns podcast, and looking forward to seeing you on another episode. Thank you now.